to the Vocational Expert Views channel. We're a new channel that discusses disabilities in a vocational expert view. Most of our content will focus on the VA claim system and the VA disability system for veterans. So, are you a veteran that suffers from a heart condition that the VA just doesn't want to pay you for? Well, I'm here to help. The heart is a tricky organ, and sometimes you don't know something's wrong until it's really wrong. Let's look at some of the diagnoses. There's ischemic heart disease, coronary artery disease, congestive heart failure, atrial fibrillation, arrhythmias, heart murmurs. So, what are some of the symptoms you might be affected with? Well, you might have chest pains and tightness. There could be fatigue and weakness with either the simplest activities of getting out of bed, going to take a shower, brushing your teeth. You might be able to walk to your mailbox before you start breathing heavy. Some people have problems bathing. Sometimes just eating a simple meal can be exhausting. There's also swelling in the ankles or feet, and weakness and fatigue goes back to shortness of breath. Heart conditions can also lead to a stroke, artery disease, depression, and at a minimum, heart issues keeps you from working through work limitations, and we'll discuss work limitations later in the video. So, what is needed for a successful VA claim? Well, first you have to have official heart diagnosis. So, basically, you need to go and see your doctor, whether it's through the VA or through your private provider, and get official heart diagnosis. Second, if you're going through a VA claim, you need connection to military service. This can be direct related to service, secondary related to service, or presumptively related to service. And this will be in your medical opinion. Sometimes you'll get an opinion or a diagnosis from your private doctor, and the VA will send you for a CMP examination in order to reconfirm what your private doctor has diagnosed you with. Also, to get a better grasp of your symptoms that you have and what limitations you have. So, let's look at some quick work limitations. Unemployability is assessment in the VA or TDIU is only concerned with competitive employment, which is individual unemployability. Now, there are some that seek a vocational expert that want to work, and when we look at work limitations, we're actually looking for job accommodations and how to overcome them. When it comes to the heart and all disability issues, treatment plays a crucial role. You want to make sure you are effectively managing your heart condition through medication, lifestyle changes, and other medical interventions. Whether it's the VA system or the Social Security system, they're going to be looking for your records for ongoing medical care and consistent follow through with what your doctors are telling you. This goes back to regular consultations with your doctor, and if you're still employed, talking with your employer. So let's look at ischemic heart disease and coronary artery disease. You're looking at reduced stamina and exercise tolerance. So when we look at work limitations in this aspect, we're looking at limited ability to lift, handle, grasp, pushing and pulling. It might move a person who's used to doing a heavy duty job or medium duty job into doing light duty jobs or sedentary jobs. And if your heart functioning is very poor, it can also make even the simplest sedentary jobs too physically demanding. In addition, coronary artery disease can cause chest pain and angina, and this is often triggered by stress or exertion. This is going to limit your work performance. It means that a worker will probably need frequent breaks, a slowed pace, or a less physically demanding job. And then, of course, there's fatigue and shortness of breath. And this may limit a person's ability to work even full-time or part-time. Again, this goes back to physical aspects of a job. With congestive heart failure, some of the work limitations we're looking at is due to fluid retention and swelling. So this is going to limit posturals such as standing or sitting or even walking for extended periods of time. So that can move a person down from light into sedentary or possibly knock out sedentary due to physical positioning. Fatigue and decreased exercise tolerance, which is similar to ischemic heart disease. These symptoms can impact work performance, and you need changes in your workload or schedule, or you might be able to be unable to work. And then again, shortness of breath and difficulty concentrating. This is going to make the worker have more errors at work, be off task more, probably needing more breaks. Atrial fibrillation and arrhythmias. So, irregular heartbeat and palpitations. These can be concerning, and when they happen, they can affect a person's focus and concentration and impacting jobs that require precision and alertness. When we're looking at this, we definitely want to have doctor's limitations and notes on this. Dizziness and fainting spells. This is because your heart's not pumping your blood flow consistently, and so you'll faint. And this is going to create safety risk in certain work environments, and it's going to necessitate job modifications or restrictions if you're wanting to work. This also increases your risk of stroke, which is also a safety risk at work. So, heart murmurs. Heart murmurs can have work limitations. Oftentimes they don't. If you have heart murmurs, then we're definitely going to try to get restrictions and limitations from your doctor. But a lot of heart murmurs are harmless and don't restrict work activities. It really depends on your symptoms and issues and the severity. So remember, everything we talked about here as far as work limitations are general guidelines. We would have to look at your symptoms and your medical records and how they affect you to see exactly how they impact you and your workability. We do vocational evaluations for veterans nationwide. We've done them for veterans living in Guam and the Philippines. We conduct vocational expert evaluations across the world through video and telephonically. Feel free to ask us questions or give us feedback. You can even request new topics for our channel below. Don't forget to subscribe so you won't miss our future videos. If you're looking for our vocational expert expertise, I have over 20 years experience as a vocational expert and have been certified as a certified rehabilitation counselor for over 20 years as well. I've done many professional seminars for the American Board of Vocational Experts, International Association of Rehabilitation Providers, National Association of Rehabilitation, Georgia Licensed Professional Counselors Annual Conference. I also have a contract with Social Security Administration as a vocational expert, and this has been for over 10 years, and I've done over 10,000 Social Security hearings. I've done vocational evaluations for Georgia Department of Labor Rehabilitation Services. I've done psychological assessments and vocational services and job placement for Georgia Department of Behavioral Health and Developmental Disabilities. And I've worked at North Fulton Regional Hospital doing cognitive rehabilitation as well as vocational services where we specialized in traumatic brain injury. So if you're interested in a TDIU expert evaluation, step one, schedule a personal consultation with me about your TDIU application. You can contact us here at this email with the subject TDIU. After that discussion, if everything looks good, then we're going to look at your medical records on an in-depth level, as well as your psychological records. We'll suggest psychological testing or other testing if needed. Usually it's not. And then step 4 is a vocational expert TDIU report.